Hello, everyone, and welcome to Heads Up, the weekly webcast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, founder of the Facebook group Migraine Nation, and chronic daily migraine survivor. I am super excited to introduce you guys to someone new today. This is Dr. Matthew Robbins. He is an assistant professor and the neurology residency program director at Weill Cornell Medicine. Hello, Dr. Robbins. How are you?
Hi, Dr. Weitzel. How are you?
Great. So happy that you're on today. Thank you for being here.
You're welcome.
So we have a topic today that is important to everyone. It's important to people with migraine. It is important to physicians. It's important to everyone in the migraine and headache community. We are going to talk about headache education, how it impacts us all, what changes might need to be made, what we can do, how it can be improved. So let's all focus on what Dr. Robbins has to say. He gave a talk on this recently at the Diamond Headache meeting, and I was there. It was a very good talk. So let's see if he can impart some of that wisdom to us. So Dr. Robbins, in your view, what is missing in headache education today?
Well, I think that headache education is such a critically important topic in all medical disciplines because headache is such a common problem, particularly with migraine and even chronic migraine. And there are very few disciplines of medicine in general where headache is not encountered.
Right.
And I think it's fundamental to have headache education as early as possible in the medical education process to reach as many people as possible.
Right. Can you speak just right as we get started, speak to the headache specialist shortage that we currently have in our country?
Well, we do have more headache specialists than ever before, but that number is still in the 500s typically from year to year. And although there are efforts to increase that number by having more fellowships and having better education amongst trainees who then pursue fellowships, there's no way that 500 plus headache physicians can actually care for the upwards of 40 million people in the country with migraine, or the millions of people of chronic migraine, and certainly beyond in other medical disciplines. So I think depending on just fellowship trained headache specialists to care for this huge population that needs more nuanced care for migraine and other headache disorders is not the only answer.
Right. So let's explain really quick to anyone who might not know. In order to really be considered a headache specialist that's certified in that, you go through a fellowship in headache medicine. And we don't really have residencies in headache medicine, and there's not a whole lot of training in medical school in headache medicine. So can you just speak to that really quick for me?
Sure. So the process is typically, 4 years of medical school or osteopathic school, followed by a residency in a certain discipline. That could be neurology, that could be family medicine, that could be internal medicine, that could be pediatrics or pediatric neurology. And then that could be followed by an extra year of doing a fellowship in headache itself. And that's the most common path is really for a neurology trained resident to then pursue an extra year of headache fellowship. Now, the problem is that, as we mentioned, the fellowships are few and far between, and we don't have enough people to participate in them. And also, many people who manage headache are also managing so many other things. They could be managing a patient holistically in primary care, family medicine, or women's health. And that really shows that the emphasis on education for headache has to be as early as possible. And there's some evidence that on average, students in medicine only get on average 1 or 2 hours of education on headache altogether. And that seems very unfair, given that migraine might be the second most disabling cause of disability worldwide.
Right. Okay. So which medical disciplines do you believe should have additional education in headache medicine?
I think no matter what the multiple choice question is, the answer is always all of the above. I think as a neurologist myself, even though neurologists are most often the specialists who someone is referred to see someone with headache, even us, we don't have enough headache education. Neurologists have a lot to learn in their training experiences, including how to manage stroke, multiple sclerosis, Parkinson's disease, vertigo, neck pain, back pain, brain tumors, epilepsy, Parkinson's, and other movement disorders. There's a lot to learn. But often residency training is very weighted towards hospital medicine as opposed to office-based medicine, which is where which is where people with headache problems most often seek consultation.
Mm-hmm. There's a lot of people who will be watching this podcast who are in groups where we talk a lot about, even though we try to avoid it as much as we can, many people will end up in the emergency room at some point with their most severe migraine symptoms, when they're status migrainosus, etc. So in your mind, what ideally should be included in the education for like emergency room physicians for people who end up there who have migraine, severe migraine?
That's a great question. I think given that migraine is one of the most common medical conditions encountered in an emergency department, clearly more education needs to be made from the ground up for those clinicians, whether it's physicians, nurse practitioners, physician assistants, nurses, et cetera, to manage people with migraine in the emergency department. And in the current climate of really trying to find opioid alternatives, and the emergency department is a place where opioids have been used with a lower threshold for a variety of medical conditions, but including headache and migraine disorders. Mm-hmm. This is where education is really needed. And this could include having emergency medicine physicians understanding a variety of different IV medications that could be used, and even procedures such as nerve blocks, which many headache specialists perform, but could really be performed more widely in an emergency department because they seem to be quite safe and work for many patients.
Okay, I'm really glad we addressed that. So when it comes to individuals with chronic headache conditions, whether it be chronic migraine, NDPH, et cetera, who are being managed by their primary care physician, is there a point in your mind where they should say, okay, I think I need to see a specialist? What is that point? And what should they look for in a specialist?
That's a great question. I think the answer to that might not be consistent from person to person, and it also depends on the local availability of such a specialist, which is so variable. There are states in the US that have no certified headache specialists and have a shortage of neurologists in general. But I think any person who has migraine that frequency is increasing, that is not improving with sort of a few rounds of standard treatments should be referred. I think all we know from large studies of people who have migraine is that it's very important to intervene before migraine evolves to chronic migraine. That time to intervene is much earlier than I think has ever been thought to, that has ever been considered. And many of those interventions can be done in primary care. For example, education about medication overuse, management of coexisting medical problems, including other pain problems, depression, anxiety, sleep disturbance, making sure weight is being managed properly, making sure caffeine intake is not excessive. A lot of these lifestyle and coexisting medical condition management situations can be done very well in primary care and could really help prevent the onset of chronic migraine in someone whose migraine attacks are not terribly frequent.
Right. So do you have any advice for patients who might be in a situation where their healthcare provider perhaps did not benefit from much headache education? What can they do in that situation?
Well, I think staying as well informed as possible is good. I think advocating for yourself, have migraine, really being front and center of why you need to seek care from your primary care doctor is important, because sometimes it might be underestimated, and some of the health maintenance reasons might be the crux of any checkup or any patient visit. And I think bringing resources, being informed by online initiatives and others might really help to drive the conversation to improve quality of life.
Okay. So I think that I should interject here that if you go to the National Headache Foundation, they can help you see where the specialists are in your area on their website, or if you call them. So there are resources out there to help you find headache specialists. Is there anything else that you would like to add to our conversation on headache education?
I think that the combination of patients being better informed and efforts that major national organizations are doing and advocacy events in Washington, D.C. Are really the key to making sure this problem is addressed at a much earlier stage in both education and in patients before their headache problem becomes chronic and much more challenging to manage.
Yes, that is very good advice. So that is all we have to say today on our topic on headache education. We hope you found that helpful. Please join us next week on Heads Up, the weekly webcast and podcast of the National Headache Foundation. And thank you so much, Dr. Robbins, for joining us this week.
My pleasure. Thanks so much.
Thank you. Bye-bye, everyone.